Hi, my name is Sophia Sosa, and today I'll be talking to you guys about this program called Medicare for All, and it is not implemented into our government system, but I will be talking to you guys about why you should support this type of program to be implemented. It has been talked about for a while now in the political setting. Maybe you've heard of it, maybe you haven't, but if you haven't, you will learn about what Medicare for All stands for, the pros of it. I will mention a little bit of cons and why people are against this type of bill to be passed, and I will also be showing you guys a little bit of data and statistics um, of this type of program. But yeah, let's get into it. So, what does Medicare for All stand for? What it is basically a type of universal healthcare that is a system that has been proposed and ignored or denied for many years. It is a system that would allow all residents to have access to healthcare services regardless of their income, employment status, or pre-existing conditions. And as of right now, the US has not fully implemented this type of implemented universal healthcare, but there is a lot of different types of other insurances like private insurance, employer provided insurance, government programs like Medicaid, Medicare, and the Children's Health Insurance Program. And I did also mention that there is here in the state of Texas in El Paso, they do have a Women's Health of Texas program. And in the city of El Paso, they have El Paso Health Program to help those with lower income that cannot afford healthcare and services. So, who is this program for and why? A majority of Democrats in the government say that the government has a responsibility to get the American people health care for all, and that is just a human right. Pretty much to be able to just go to your primary care physician without, having that thought behind your head, just worrying about how much money that it's going to cost, or when you have to go to urgent care or ER for an emergency, or quick care, but you know that bill is going to kick in and you have stacks and stacks of debt piling up because of some medical needs that you need pretty much to live and survive. But many people refuse to get the type of care because they're so worried and stressed about the financial part of being able to afford just a decent healthcare. And with this program, pretty much they believe that everyone should have access to healthcare, even if that means going through a single player system like Medicare for All, or by expanding and improving the Affordable Care Act, the ACA. And one of the senators, I'm pretty sure you've heard of him. He's been a very huge advocate about this program, and it's Bernie Sanders. And he, since 2017, you can go ahead and just Google and see videos of him pretty much um, stating why you should be supporting this type of bill, and pretty much just wanting to help the people of America be able just to get a decent care without having to worry if you could afford it or not. So the pros of having Medicare for all, just stated like before, it doesn't matter if you're unemployed, employed, how much money you make, if you're in a full-time, part-time type of job, you know, this program is for everyone. The public health outcomes would be better because having the access to care will be reducing the in, incentive, so sorry, indecency and severity of chronic conditions. The financial part of the insurance would be reduced, meaning that you will not be paying out of pocket premiums, co-pays, and deductibles, and they will also be lowering medical bankruptcies. So the cons of Medicare for All, pretty much on why certain people don't support it, is because it does run a risk of raising the taxes, especially on higher earners and businesses. So this just means that it would just be mainly affecting people who make more money and businesses. There would be also a risk of inefficiency and slow innovation due to decision making that must happen in the government. You know, like you've seen before in the news, it has to go through certain people for this bill to pass. And the wait times would become extremely longer than what it already is. And pretty much, you, for example, you're in the ER because you're not feeling good in the middle of the night. And this, there's not enough people on staff in the hospitals of America, doctors, nurses, to be able to take care of just pretty much the traffic they get. So doctors and hospitals would receive a lower reimbursement, which could affect care quality and availability. And lastly, some worry that the choices of providers and services would be reduced and the possibility of private insurances would be limited or even banned. So, who is opposed to it and why? The Republicans are a major group that is opposed to this type of bill. And like I stated before, the reasons why on the slide before is why they're opposed to it. They also worry of the cost and fees will have a negative impact on the country. Party leaders and lawmakers argue that such a proposal like this would lead to longer wait times, like I stated before, and they also have, proposed to have reforms that emphasize competition, personal responsibility, and private sector involvement instead. So that just pretty much they're just trying to just find a middle part instead of having, Medicare for all, that they would just reinforce the Affordable Care Act, and also Medicaid and Medicare have a little tweaks in it. And one of the main concerns is the massive cost of implementing a universal healthcare system would require significant tax increase, which, I'm pretty sure you've heard Republicans are very much opposed to. And one senator that is strongly opposed to this type of bill to even be talked about is Senator Mitch McConnell, who is an American politician and retired attorney serving as senior U.S. Senator from Kentucky. And he just describes this as a far left social experiment, and he has warned that it would lead the country towards socialism, which most Republicans are opposed to. And just pretty much here's um, a data and statistics on the percentage of U.S. residents who have no healthcare insurance. And pretty much it just shows all the states. And I do have the website down here if you want to go ahead and just copy and paste and just pretty much play with it, see for yourself how pretty much there's just not enough people applying or wanting to get healthcare insurance because of the cost. And that's something you'll see from starting 2009 to now, how much it's gone down. And pretty much, I feel like our, many people going to college are coming up to that age, turning 26, and most of them are going to be kicked off of their parents' insurance plan and just trying to look. And many of them aren't really approved for Medicare or Medicaid. So it's why you would see, I believe you would see the numbers going down. And here's my references. But yeah, I think you should be for Medicare for all because I feel like it's just a human right that everyone should be able to take care of their health regardless of their income and employment status. And it's something that I feel like we should not be stressing over. But yeah, thank you so much.